So the treatments for small cell lung cancer can vary greatly from patient to patient. And just researching the disease on your own certainly won't give you the specific information you need about how to best take care of yourself. That's why really taking advantage of your oncologist or team of oncologists is so important. Sometimes the treatment will require multiple oncologists with different specialties, such as medical, surgical, and radiation. So depending on which ones you're working with, you'll want to prepare as best as you can for each specific appointment. Now, I always recommend patients bring questions to our appointments. Some of the great questions to ask and think of are, how do we know if the treatment is working? What can I do to manage side effects from the treatment? Are there any symptoms I need to tell you about right away? And how do I reach you at different times, like weekends or holidays? But any treatment question you have are fair game, so go ahead and ask. You want to be able to keep your oncologist as informed as possible. Knowing your medical history and past and current medications you're on is so critically important. It also helps to keep track of the symptoms and the side effects that you're already experiencing. The more complete information they have, the more your doctor can provide measures that will greatly help you and improve your quality of life during treatment. Having an oncologist that makes you feel heard and encourage you to be proactive in your treatment goes a long way in making those appointments as effective as possible. Don't be afraid to make new appointments. There are a lot of great resources online for checking in remotely, especially if you just need to bring up new information or ask questions. Become acquainted with telehealth services and ask your oncologist if they're available via those resources. They can really make scheduling and keeping appointments very simple.